Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, my dear friends. Good day to you. This is Dr. J. Peter Rodrigues from Holy Family Hospital and Elizabeth Hospital. Today I'm going to discuss with you a very common problem which in layman's terms in Hindi they call chakkar and in English they call vertigo, giddiness, or unsteadiness. When a patient comes to us, what they say, doctor, we feel that the room is spinning or they feel that they are spinning. And these are very frightening symptoms. But there are different causes. One of the causes is peripheral vertigo and one is central vertigo. The symptoms are the same, but they don't carry the same level of risk. Now, let's be very simple. Peripheral vertigo means the problem is coming from the inner ear or the vestibular nerve and not the brain. The common causes of this are BPPV, benign positional vertigo, Meniere's disease, and vestibular neuritis. So, in short, the issue starts in the ear. Now, in central vertigo, the vertigo comes from the brain, especially areas like the brainstem, cerebellum, which process balance. So, there's the key difference. One is peripheral is ear and central is brain. This distinction is important because to help us understand both the risk and urgency. Peripheral vertigo is much more common, often treatable, and not usually life-threatening. For example, say BPPV can often be treated with simple repositioning maneuvers like the Epley maneuver. Central vertigo, on the other hand, is less common but much more serious. It may be linked to conditions like vestibular migraine or more urgent causes like stroke, brain stroke, or transient ischemic attack. Let's make this practical. What does peripheral vertigo usually feel like? It is very often a specific pattern. In BPPV, it means you get a brief spinning triggered by head movement and usually lasts about seconds to a minute. But in BPPV, there's always a history of a head injury. It's very important. It occurs because of a trauma to the head. Now, in Meniere's disease, the episodes are usually longer, about 20 minutes, 2 hours. You get what is very important called a fluctuating hearing loss. Means sometimes the hearing is good and sometimes the hearing is not so good. So that's called a fluctuating hearing loss. Then you get tinnitus, which is noises in the ear, or you get a fullness in the ear. This is Meniere's disease. And the most important symptoms is the fluctuating hearing loss, which will lead us to a diagnosis of Meniere's disease. Then you get vestibular neuritis, which you get sudden severe vertigo lasting for hours to days, often associated with nausea and unsteadiness and difficulty in walking. The trigger, duration, and ear symptoms give us important clues. What about central vertigo? If there's central vertigo, there's also neurological symptoms. You get giddiness, you get chakkar, but you get some other symptoms, neurological symptoms. Patient complains of blurred vision, double vision. Patient complains of slurred speech, weakness or numbness, trouble in walking or coordination, and sometimes severe headache. In these cases, we must think of some brain causes, including stroke. We use the bedside test like the Hinds exam, which is basically a nystagmus test to differentiate between stroke and inner ear disease, which causes the giddiness. For patients, the method is simple. Vertigo plus neurological symptoms is an emergency. Migraine. Vestibular migraine is considered a central cause of vertigo. It causes recurrent dizziness, motion sensitivity, and imbalance. Sometimes the headache is mild, sometimes even absent. That's why it is often missed. But very often patients come with these symptoms and they are very worried. They say, doctor, do we have a tumor in the brain? There's a tumor called vestibular schwannoma, which is a benign, slow-growing tumor of the vestibular nerve. That is the nerve of balance. This is a slow-growing and it's a benign tumor, so it's not much cause of worry. It usually causes gradual symptoms. There's one-sided hearing loss, tinnitus, and imbalance. It is not a sudden spinning episode. It's a gradual problem. And if it really is troubling the patient, the schwannoma can be surgically removed. So we have to be three things which we have to emphasize on. One is peripheral vertigo starts in the inner ear, is more common and is often treatable. Central vertigo starts in the brain, becomes urgent, and we have some other symptoms, nerve symptoms. These appear. Brief positional spinning, think of BPPV. Remember in BPPV, there's also a history of head injury. Hearing symptoms, think of inner ear disease. Fluctuating hearing loss, think of Meniere's disease. Neurological symptoms, seek urgent care, and they have to be treated on a very urgent basis. Understanding the difference between central vertigo, peripheral vertigo, and reassuring the patient that most often this chakkar is not of great significance will help a great deal to alleviate the symptoms. But just remember once again, if there are any symptoms of a nerve problem, neurological symptoms, then definitely it's very urgent and the patient has to see a doctor immediately. Thank you very much.
a public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.